Do your friends go, ooh, when you start talking? Or do you just go, when you start talking and you do it? Go ahead, go. How does that smell? Let us talk about bad breath, or as we like to call it, halitosis. So halitosis is when an individual has a very unpleasant smell that comes from the mouth, and it usually affects 1 in every 4 person worldwide. And it does affect a person's confidence. It affects their social standing, because usually if you have that problem, you're someone who wouldn't really like to talk, because you know what's going on, and it's something that is very frowned upon, and a lot of people do not even talk to you about it and be like, friend, hey, but I know. So let's talk about the causes. What causes bad breath? The first one, we know it's the food we eat, and usually that one usually goes away when you brush and you floss. So the second, the one that I would say is really the most common, is poor oral hygiene. More than 50% of the world's population do not know about flossing, nor do they utilize flossing. So our teeth basically have 5 surfaces that are exposed when you look at a tooth. So let's say this is your tooth, right? This is in the gum. This is the top part, we call it the occlusal. Then there's this one, then there's that one, then there's another tooth here, right? And then this is where the tongue is if you're looking at the bottom, and then this is where the cheeks are. You're able to brush all 1, 2, 3, but you're not able to brush these 2 because there are teeth next to them. So you need floss. Floss is a very, very thin like material that can be used to clean in between your teeth, because remember, a toothbrush is very big and it cannot really fit in between the spaces of your teeth. So it is very important for you to floss, to try and remove the plug that stays there after eating. It is very important to have that and do it every day, because if the food stays there for longer, it causes calculus, which is a hard substance that you can't really remove with a toothbrush, and you need to have a professional cleaning done by a dentist. Let us not talk about oral hygiene in this video. We're talking halitosis. The second one is smoking. We know that smoking is also a cause because of the things that you smoke and the ingredients that are found in the composition of whatever you're smoking, be it vape, tobacco, and all of that. Also, the most common one is not brushing your tongue. Technically, your tongue is not supposed to be white. You know that white, you know the white I'm talking about. Brush your tongue. Get a tongue scraper or get a toothbrush that has another component to clean the tongue, because the tongue has a lot of finger-like projections that traps food and bacteria, and the more it accumulates there, it builds off, it washes off onto the tongue. It builds a thick layer, and that layer, when you start talking, then it gives off that odor. So those are some of the common causes of halitosis. Also, it is very important to note that some medical conditions might bring about this condition. You might have an infection in your nose, or in your respiratory tract, your lungs, or sometimes there's something going on in your stomach. Then for that, it is very important for you to actually get a dental checkup so that they understand the root of it, what's the cause. We do not just go to the dentist for an extraction. That is not the only service that dentists do provide to the service, to the public service. We do quite a lot, and it is very important that you understand what your dentist can do for you. Also, cancer can be one of the things that causes bad mouth. Well, bad smell, yeah. It's one thing, which is why it's important for you to see your dentist every 6 months. Okay? Go and make that appointment right now. Call them. Make that appointment. The other thing is when your teeth are rotten. You know, when your tooth is rotten, you know. It gives a smell. It gives a smell, and it's... Yeah, so it is very important for you to understand what is the root cause. And you can only do that by seeing your dentist. And the other one is if you just had an extraction and there's some food that is there and it's healing and it doesn't really smell nice. We spoke about food, and we also covered various conditions such as something in the lungs. Sometimes also diabetes can cause that. Okay? Yep. Depending on the cause of your bad breath, the treatment can be different from one person to another. If it's due to your oral health not being adequate or being enough, then you need to improve on that. Get your professional cleaning, make sure that you floss, you integrate a mouthwash or an antimicrobial mouthwash into your regimen, and floss. Floss, 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 and brush your teeth twice a day. That is what we would do for you. But if you have gum disease like gingivitis, you know when your gums start bleeding when you brush? Yep. Or your teeth start shaking, they're shaking, they feel a bit loose. That is when you have some form of gum disease. And in that instance, it's very important to see a dentist so that they can do a proper diagnosis and do your professional treatment in-house. And we spoke about if there's food that's staying there for too long, plaque, calculus, then the professional cleaning will help with that. But now let us talk about if it's a health condition. What if it's diabetes or it's a liver disease or something? Then in that instance, you would get a referral to see your MO to treat that, because most of the time, most people don't even know they have that. That is why you don't know that is the cause. So then you would have to see your medical officer who will be able to diagnose you properly and give you further management. Also, brushing your tongue can help. If you believe it could be the tongue, check your tongue and see how it looks. And also, chewing gum, sugar-free gum, it better be sugar-free. And also making sure that you avoid smoking, brush your teeth regularly, and see your dentist. Okay? So that is with regards to halitosis. We are going to be covering other dental related conditions or challenges that patients have, and what can you do about them at home. Bye guys.